Hello everyone, my name is Nurse Steven and welcome back to my YouTube channel. Today we're going to be talking about IV fluid therapy, and this is not just going to be a surface teaching. We are going to try to understand why we choose certain fluids, how they affect the body, and how to think like a nurse when administering them. Let me ask you a question. If a patient comes in with severe diarrhea, low blood pressure, or weak pulse, what would you give? Is it normal saline or dextrose 5% water? If you can't answer that, then this video is for you. We're going to be covering all major IV fluids you encounter, how they affect the body, when to use them, common mistakes nurses make during their administration, their possible reactions and complications from therapy, and finally, we'll be treating some scenario questions that are being asked in exams. Briefly, what is IV fluid therapy really? IV fluid therapy is the administration of fluids, electrolyte and medications into a patient's bloodstream through a vein. It is either given to help restore circulating volume or to correct some electrolyte imbalances or provide energy and also to maintain hemostasis. In a simple time, it is just helping the body to maintain balance when it cannot do it alone. Moving on to the next, the body has three fluid compartments. One is intravascular, which are inside the blood vessels. Two, we have the interstitial. These are between different cells in the same tissues. And three, we have intracellular, which is inside the cells themselves. So, different fluids shift water between these compartments. And if you can understand how this compartment works, IV therapy becomes very easy for you to understand. Moving on, we have different classifications of IV fluids. IV fluids are divided into four major classifications. One is the isotonic fluids, which are the type of IV solutions that are very similar in concentration with the blood plasma. So because of this, they do not cause fluid to shift in or out of the body cell, and the fluid always stays mainly in the blood vessels, which is the intravascular space. They are used to expand intravascular volume without causing significant fluid shift into or out of the cells themselves. So think of it like pouring water into a bucket that already has water. Nothing changes, just that the water increases in amount. Two, we have hypotonic fluids, which are IV solutions with lower concentration than blood. These ones help to move water from blood vessels into the body cells, and what actually happens in the body is that fluid moves from intravascular space into the intracellular space. Actually, you can think of it like the bloodstream is salty and then you're trying to add more plain water, which tends to move into those cells to help balance up the concentration. Three on our list, we have hypertonic fluids, and these are IV solutions with higher concentration than blood plasma. So because of the higher concentration, they tend to pull water out of the body cells into the bloodstream. Just think of it like you are putting a very salty solution into the blood. So the salt tends to pull water from various surrounding cells into the bloodstream. Finally, number four, we have colloids. Colloids contain large molecules, either protein or starch-like substances. This large molecule stays inside blood vessels and they cannot easily cross into cells. This process is due to what is known as the oncotic pressure. Oncotic pressure is the type of osmotic pressure that's exerted by plasma proteins, especially albumin and starch-like substances, that tends to pull water into the blood vessels from surrounding tissues because of the pulling force. Next, we're going to be talking about the examples one by one. So let's go. First, we have the 0.9% normal saline. This contains sodium and chloride and is mainly used for shock, dehydration, blood loss, vomiting and diarrhea. And when you use it excessively, it can cause hypernatremia because it is an isotonic fluid. And then likely adverse reaction could be pulmonary edema or hypertension. Two, we have Ringer's lactate. Ringer's lactate contains four different kinds of nutrients, which are sodium, potassium, calcium, and lactate. It's mainly used for burns patients or trauma patients, such as road traffic accidents or chemical injuries, and is used during surgeries also and for cases of metabolic acidosis. And possible adverse reactions from Ringer's lactate could be hyperkalemia or fluid overload. 3, we have 0.45% normal saline. This is just like half of the normal saline we mentioned earlier. It tends to move water into cells because it is an hypotonic fluid and is used for cellular dehydration and cases of hypernatremia, but you should never give it to an hypotensive patient because allergic reaction could be circulatory collapse. Number 4, we have the dextrose 5% in water. Initially, it is isotonic but tends to become hypotonic in the bloodstream. It's mainly used for cases of hypoglycemia or mild dehydration, or cases of patients who need energy and they are not able to take in food. So the reaction from them could be hyperglycemia or fluid shifts. Number 5, we have 3% normal saline. This is a very concentrated IV fluid and is being used for severe hyponatremia because it is an hypertonic fluid, and because, as I explained earlier, it tends to pull water from cells into the bloodstream and is used for cases of increased intracranial pressure also. And likely reactions from using 3% normal saline could be brain damage due to osmotic demyelination. This is a kind of neurological condition that occurs when hyponatremia, which is low sodium, is corrected too rapidly, and it can lead to damage of the myelin sheath in the brain. Number 6, we have dextrose 10% in water, dextrose 20% in water, and dextrose 50% in water. These are classified all together because of the high glucose concentration, and it is mainly used for severe hypoglycemic patients, and likely adverse reactions could be hyperglycemia or vein irritation also. And number 7, we have dextrose normal saline. This is very common in the hospital. It is being used for patients that need both fluid volume and energy at the same time because it contains sugar and salt. So you must always take caution while giving it to diabetic patients. Number 8, we have albumin. Albumin is a major plasma protein found in the blood, and it is being produced by the liver. It is a colloid and is being used in cases of severe hypoalbuminemia or burns or cases of liver failure also. And reactions could be allergic reaction or fluid overload also. Lastly, we're going to be talking about dextran. Dextran is not very common, but you might encounter it in clinical postings. It is a synthetic colloid made of large sugar molecules and is used as an IV fluid to expand blood volume by increasing the oncotic pressure. I explained oncotic pressure earlier. And risk for patients using dextran could be coagulation problems. You don't use it for patients with coagulation problems because dextran interferes with clotting factors. Moving on, common mistake nurses make during IV therapies could be hanging wrong fluid or not checking the concentration or incorrect drip rate. This could affect in cases of diabetic patients. When you use dextrose saline excessively, it could affect the patient. Not monitoring long sounds, ignoring the intake and output. You are not recording the intake and output of the fluid. It could be very dangerous to the patient. You don't know the amount of fluid that is storing in the body and the amount of fluid that is being excreted. We have giving hypotonic fluid in shock, rapid sodium correction, and then remember, IV fluid is a drug, so you must always take note of the adverse reactions. I'm talking about the reactions. The possible reactions and complications could be fluid overload or pulmonary edema. This is very common. Electrolyte imbalance. We have hypernatremia in cases of hyponatremia patients, hyponatremia in cases of hypernatremia patients. Likewise, vice versa for hyperglycemia and hypoglycemia. We also have phlebitis and infiltration. This can occur during the IV fluid therapy. So always monitor for vital signs, urine output, the lung sounds, and edema. And now I'm going to be asking us few questions, and we're going to be answering. If you can answer them properly, then you've been able to gain 1 or 2 from this lesson today. 1. A patient with severe burn is admitted. Which IV fluid is most appropriate initially? A. dextrose 5% water, B 0.45% saline, C Ringer's lactate, and D dextrose 50% water. What would be your fluid to administer? If you mention Ringer's lactate, then you are correct. Reasons is because born patient needs isotonic fluid with electrolyte. 2. A patient with severe hyponatremia and seizures comes in. Which fluid are you going to administer? A. Dextrose 5% water, B 3% normal saline, C normal saline, D 0.45% saline. What will be your answer? If you mentioned 3% normal saline, then you are correct. And with that, we've been able to learn a lot today. And finally, the nursing responsibilities during IV therapies include confirming the prescription, checking patient identity, and you must always check the fluid type, the expiring date, the correct rate, and monitor the patient's response to these therapies. And don't forget, always document after therapy. So when you understand this IV fluid therapy deeply, you'll be able to stop memorizing and you start reasoning. And this is what makes you not just a student nurse, but a safe and more competent nurse. So if this video has helped you, please like, subscribe, and share with your classmates. I'll see you in the next video.